Good day everyone, I am Dr. Athira Ramakrishnan. I am an ENT head and neck surgeon practicing in Bangalore for past 20 years, and for last almost 6 to 7 years I have been a robotic surgeon. Many people ask me, what do you do with the robotic surgery in head and neck? There are a lot of conditions where we can use a robot which will improve the surgical precision and accuracy, and some of them are thyroid nodules, throat cancer, growth in the throat like tonsillar growth, tonsillar masses, and sometimes parathyroid adenoma surgeries. And even now, the robotic surgery was mainly used for cosmetic purpose. Like if you wanted to avoid a scar in the neck and you wanted to undergo thyroidectomy, we can access the thyroid gland through small keyhole placed in the axilla or near the breast, and you can access the gland and we can remove. But as we gain experience, we have realized that the robotic surgery is very meticulous, and as we improve our quality, we can use it for even treating very like cancers also, and it gives a very good clearance. And now beyond the cosmesis, we are using it for many other conditions like thyroid cancer, throat cancer. Even under my team, we do a surgery called RIA-MIND, which is robotic intraclavicular approach neck dissection, modified neck dissection. So we used it to remove all the lymph nodes on one side of the neck at a time, and variations of these procedures have come up where we can even do both the sides neck dissection without a scar using robo. So the robotic surgery is still evolving, and we are all getting better at it every day. And lot of scenarios, like mainly our indication with thyroid is removal of throat cancers without opening the jawbone or without giving a lot of morbidity to the patient. So we can do this with just the very remote access is possible with the robotic surgery. Key benefits, first one was the cosmesis, because we can avoid a scar, and usually these are remote access surgeries. We place small keyholes in the other parts of the body, like in the axilla near the breast. We use that keyholes to allow the robot to enter into the space where we need to operate. In head and neck, I perform mainly throat cancer surgeries and throat tumor surgeries, thyroid nodule removal, thyroid cancer removal, parathyroid adenoma surgery, and sometimes we do neck dissection for oral cavity cancers which are not very big, lymph nodes are not there, or the lymph nodes are not stuck to any other muscle in the neck or any other critical structures in the neck. We can even address them using robotic surgery. So advantage is the robo itself has got this magnification. Up to 10 times you can magnify the image on the screen using the robo. So once we put the robotic into a surgical field, we can actually magnify the vision. It is like using a microscope which is sitting inside the body of the patient. So it gives much better clarity. And the robotic surgery has its own instruments which are embedded in the robo. So we use it these are precision instruments. We use it to cut, burn, remove the tumor. You can actually, we'll share the link in this thing where we can see the videos where I have done some robotic surgeries. So very good precision is possible, and as we gain experience, we can do more and more complicated procedure. So the one is cosmesis, second is improved accuracy, and better magnification means better clearance of cancers, tumors, everything. So it is like while you are doing the surgery, we can look at a structure 3 times, 4 times more, and up to 10 times. So most of the time doctors can wear a loop, but that loop gives a vision from far away, not like you are looking at it very closely. And when you are using a loop, you are using the other instruments which are externally from the patient. This robo gives instrument which can be used inside the patient, and this gives much better precision, much better access. And also as we gain experience, it improves the clearance of the disease. Robotic surgery duration depends on the kind of surgery you have to do. If it is a throat surgery where only one tonsil needs to be removed with the base of like in the throat cancer, we have to remove the tonsil along with the base of the muscle, the tissue which is below the tonsil, up to 3 layers. So this surgery takes for an experienced surgeon around 1.5 to 2 hours. And in thyroid surgery, actually, there is a lag time, because first you have to create access to reach the thyroid from both the axilla and near the breast. We can make keyhole incision. So this takes extra around 30 minutes. So as we, like I say, this all the surgeries, robotic surgeries, they have a learning curve. And usually people who are well versed in open surgery only have to get training for robotic surgery. So you should be already proficient in doing an open surgery before you can become a robotic surgeon. Because if you have a complication in robotic surgery, you have to open and deal with it. Like, you have to give a skin incision and deal with whatever complications you are having. So only after you train enough in the open surgery, we get training in the robotic surgery. So as we gain experience, the lag time of access, like you're putting the ports that gives you the channel to put the instrument into the neck, which can reach the thyroid, that initially may take around 45 minutes. As we gain experience, you can even do it in 10 to 15 minutes of time. So that time is added. And the surgery itself, if you are doing, like say, if you're doing a hemithyroidectomy, it takes around 45 minutes to 1 hour. And if you're doing a total thyroidectomy, around 1.5 hours. But if you're adding different procedures to the same procedure, like you're doing a cancer surgery, you're doing a total thyroidectomy, sometimes we do a lymph node clearance along with that. So that adds on to the time. So usually around 3 to 4. Like, the criteria is, if you take in an open surgery around 2 hours, we may take around 1 hour extra in a robotic surgery. Recovery time is a critical factor, because since there are no big cuts in the skin, there are only keyholes, so the recovery time is much faster compared to the open surgery. But because especially in oral cavity cancers and all, if you have to access the throat cancer, you have to actually give a skin incision here and split the jawbone, and then you have to reach that area. So each layer has to heal. After the surgery, the skin layer has to heal the bone, which should be plated using a metal plate that has to heal. So all that is saved when you do a transoral robotic surgery. We open the mouth, and the robotic instrument can actually go inside and deal with the cancer without actually opening the skin here or opening the mandibular, the jawbone. We can actually go inside and remove the cancer, or if remove the tumor in the mouth. So this is a big advantage. The patient is saved a skin incision. Patient is saved a very painful the planned fracture of the jawbone. So all this improves the recovery time, and usually these patients are discharged within 3 to 4 days, and that's actually more. Most of the time they can be ideally discharged on the second or third day, but since cancer surgeries can sometimes have delayed bleeding, we usually observe them for around 4 days. Thyroidectomy usually is you be discharged on the second or third day nowadays. As like I said, this involves a learning curve. Initially, if you're doing, you may actually would like to see the patient for more to avoid any kind of mishaps later on. But the average second or third day, the patient can be discharged. This improves the small incisions and lesser cuts in the skin reduces the recovery time. See, robotic surgery, we are doing the same surgery that we are doing a robot. Without, like in a regular scenario, whatever surgery we are doing, we usually use a robot to do it. So it's essentially the same procedure. We are using the robot to do. In the robot, that usually the system that we use is Da Vinci robot, but in the market, a lot of many new ones are coming, like CSI Mantra and all are coming. So these different kinds of robots are there. Like if there are some robots where you press a menu, they will do a particular task. But surgical robots are currently what we call master-slave robots. The surgeon is the master. The robot does whatever the surgeon makes it to. Like I move on my hand like this, the robot also moves my hand like this. So it's essentially the surgeon is doing, but the robotic arm, like my hand can rotate this much, but the robotic arm can rotate 360 degrees. So if there are areas which my hand cannot reach, like inside the throat, very deep area, my hand may not reach, or we cannot see what is happening inside. But the robotic camera and the robotic hand can reach much beyond what a human eye or human hand can reach. So this is the advantage. So what happens is the robot has a much better reach in especially deep areas. In head and neck perspective, we use it for throat cancers. It's a and throat cancer, even voice box cancers, it can be very helpful. This is a commonly asked question. So they ask us, is a robot going to do the surgery? Robot is a tool which performs a task the surgeon plans to do. It is not that the robot is sitting and doing, but the robot has got better precision, so a better mobility. Like I said, the degree of movement, the flexibility. It has got joints which has got reach beyond the human capacity. So, like what I can do with my hand, beyond that robot can do without any problem. So it is the surgeon who is doing. He is making the robot do the task. The ability of the robot allows the surgeon to go many degrees further. It's like that. It's not that the robot is not blindly doing the procedure. The surgeon is sitting on the console. He is directing the robot to do the procedure. He or she. Like in my case, I am doing. It will be a woman. Lot of women are doing robotic surgery nowadays. So especially in the head and neck field, we have quite a few women now taking up robotic surgery. See, the cost is the robo itself is a very costly machine. Most of the time, it will be it's hospitals who buy it. We as surgeons, we use them. We usually have to charge for. Usually, the charge is per instrument we use. Like you need to do a oral cancer removal, we need to use 2 robotic instruments. So it comes around 60,000-70,000 extra than a regular surgery. But like we use a laparoscopic system and you're doing a laparoscopic cholecystectomy, which costs extra 30,000 for the patient. This is similar to that extra. But in the coming years, as the robotic surgery becomes more common, this cost can be reduced. More and more the innovations happen, the cost of the robotics will come down in the future. And thank you for your patient listening. Keep watching our videos. We'll be coming back to you with a lot of more informative videos.